Yo, good day, guys. Today we'll be talking about maternal adjustment in pregnancy. Now, what does maternal adjustment in pregnancy mean? This means that the effect of pregnancy on the mother that is actually carrying this pregnancy. Okay, so maternal adjustment during pregnancy. Let's move. And pregnancy affects vertically all systems in the body, placing what a considerable level of stress on the mother. Okay. Now, observed effects are attributable to what hormones. Okay. Um, the effects you observe are attributary to hormones. Now, these are the different effects of pregnancy on a mother, but I won't bore you guys with the pictures. We'll go straight to what the lecture has for us. What's the effect of pregnancy on the GI system? That's the gastrointestinal system. I would say that there's loss of smooth muscle tone that results in what constipation, and there's regurgitation of gastric content. All right, which leads to what heartburn. There's morning vomitings, okay, due to activation of vomiting centers, okay, of of um of the hydrogen, okay. Then how about the reproductive system itself, reproductive organ? What's the effect of pregnancy on reproductive organs? First of all, we talk about the uterus. We said that the uterus increase weight. That's from 50 grams to um 1 kilogram. This is due to what? Hyperplasia and hypertrophy coupled with increased blood flow. Okay. How about the cervix? We said that the cervix become what? Swollen, softer and cyanose to effects of what estrogen and and this in progesterone. Okay. There's increased ectropium and high vascularity. Okay. How about the vagina itself? The high vaginal desquamation and hence what discharges and high vascularity. Okay. How about the breast? There's increased glandular ducts and alveolar growth resulting in high breast mass. Okay. These are body changes during pregnancy. This is just like a summary of everything we are talking about. So just do yourself a favor by pausing this video to look at all these things and write them down. What is the effect of pregnancy on the respiratory system? We said that there's increased ventilatory rate due to what? Progesterone stimulation of the respiratory center in the medulla. There's high basal metabolic rate with attendant 20% rise in what? Oxygen consumption and equivalent what? Um, Carbon dioxide production. Now there's reduced what? Diaphragmatic excursion due to growing what? Uterus. What is the effect of pregnancy on the renals? I would say that there's rise in renal blood flow due to a rise in cardiac outputs. There's increased glomerular filtration rates with attendance occasional glyceria, and there's enhanced clearance of substances. The ureters lost tone, and this leads to what? Frequent micturition, stasis of urination, and predisposition towards urinary tract infection. Okay, that is stress during pregnancy, different types of stress, okay, and so on. What is the effect of pregnancy on the cardiovascular system? There's a high cardiac output due to increased what? Blood volume, that's fluid retention. There's also increased loudness of S1 and S2 sound. All right, but split heart sounds may be normal. Okay, S2 is heard by what? The 20th week. There's systolic murmurs may be heard, but this disappears afterwards parturition. Few may have transient diastolic murmurs, while others may have what? Continuous murmurs due to what? Increased mammary blood flow. There's rise in heart rate, there's rise in SV, all right, all these rises, okay. Then talk about the effects of of pregnancy on the CVS, and we'll be focusing on the blood volume and the hematocrit. I will say that sodium retention with attendant rise in blood volume. There's depressed test threshold. Okay. There's depressed test threshold. There's reduced plasma oncotic pressure. There's drop in hemoglobin concentration due to what? Blood dilution. And consequently, hematocrit and red blood cell fall. Okay. There's drop in serum albumin. Organ blood flow rises, especially in uterus, placenta, mammary gland, kidney, heart. Okay. And plasma folate falls. White blood cells rises. Okay. Fibrinogen concentration what? Rises. Okay. These are the various effects. Now, what is the effect of pregnancy on skin? There's increased lightening of skin due to what? Estrogen and what? Progesterone. There's increased warmth due to thermogenic effect of what? Progesterone. There's increased adiposity of the hips and the thighs. There's increased expansion of skin to accommodate growing breast and abdomen. Okay. There's consequent stretching of the dermis and tearing of the elastin tissues, causing what? Stretch marks. There's increased melanin deposition around what? The areola and linea alba. Okay. There's also temporary darkening around the nose and cheeks, all right, also known as cloma, and this disappears after pregnancy. Okay. And how about the hormonal changes? Hormonal changes in human maternal blood during pregnancy. So these are the hormones, okay, various hormones, and these are the changes. Okay, these are all the peak values and the times of peak secretion. Okay, first trimester, second trimester, term. Okay, all right. So with these guys, we are done with um maternal adjustment in pregnancy, and I'll see you guys in the next tutorial. Bye for now.